Yeah, thanks for a nice introduction. So we're going to start with the topic. हाँ, अभी आ रहा है वो मतलब प्रेजेंट हो रहा है ना? ओके, okay. So if you are, you can visualize this all the things. Yeah.
Yes, sir. Yes, sir.
So what happening? Okay, I am not going to see myself. So welcome all. Today we are going to deal with the topic which may not be a great interest for all of you because you may not think it is very academic topic, but it may help you to secure your futures, not only yours but your children's also, and maybe your friends, family, and ultimately others members in the society also. In my view, everyone in our society should know about this topic because knowing about these disorders is the only way to save ourselves, our next generation from these diseases which may have great morbidity and mortality. Before going further, I request you to please fill these forms. It is not compulsory to write about your personal information. If you want to write, you can write, otherwise, it's not compulsory. And you should answer the questions which answer you know. Otherwise, there is only other option also key not known as. So you can tick on that not known option, but don't guess and give the answer because there is not going to have any certificate or mark for more right answer or wrong answer. When in single questions, you should ask about both disease, sickle cell and thalassemia. You can answer according to your knowledge about any one disease. So if you know about sickle cell disease, you can answer according to sickle cell disease, or you know about the thalassemia, you can answer according to thalassemia. We will wait for 5 minutes, and I hope in 5 minutes everyone will be able to do this job. I hope everyone must have filled this. Can we proceed? Hello?
Yes, yes.
Yeah. So, how many of you heard about sickle cell and thalassemia? I think most of you maybe must be heard about this disease. So, please watch. This is a short video. Okay, video is not visible. Okay. If you are you seeing the video now, audio is audible.
इनमें से कोई भी बच्चा अपना सपना पूरा नहीं कर पाएगा। अगर वो कुछ कर पाएगा तो सिर्फ ईश्वर से प्रार्थना। ये कहानी है दिव्या की और उसके जैसे अनेक थैलेसीमिया मेजर बच्चों की।
So I know कि every one of you must heard about the malaria and typhoid, but many or some of you may not heard about the thalassemia and sickle cell disease, or may not be knowing in details about this disorder because we think these are a very rare disorder. But is it so? So, that is the not thing. So in word, there may be 5 people. If we screen approximately 100 people which are normal without any symptoms, then we may get 5 people which may be associated with some or other form of hemoglobinopathy like sickle cell and or thalassemia. While in Vidarbha or many states of India, if we screen 100 peoples, then we may get 10 or 15 pupils which may be trait for sickle cell and or thalassemia. So it is a quite common disease, and knowing about this disease is very important because prevention is the only way to cure this disease. This is the condition in India in which you can see thalassemia trait. Almost all states of India may have thalassemia trait persons ranging from 3 to approximately 17% of thalassemia trait incidence, while sickle cell incidence may range from 0 to 13% in different part and different communities of India. So what is the sickle cell and thalassemia? These are the disorder associated with hemoglobin moiety in RBC. So we all know about the RBC, which gives the red color to our blood. In RBC, there is a hemoglobin structure which bind with the oxygen and act as the oxygen transporter to different part of our body. This hemoglobin contains 4 chains, out of which Hba and Hba2 are the common chains present in the adult hemoglobin. Hba consisting of alpha 2 and beta 2 chains, while Hba2 consists of alpha 2 and delta 2 chains. HbF usually present in very small amount after 6 months of age, which is less than 2.5%, and HbS is a not normal component of sickle cell not normal component of a normal person. So it is only present in the patient with sickle cell disease. So if this hemoglobin structure got changed, then patient may suffer with sickle cell and or thalassemia.
सिकल सेल व थॅलेसिमिया हे
So
आपल्या लाल रक्तपेशीमधील हिमोग्लोबिनशी संबंधित आजार आहेत. सामान्य लाल रक्तपेशी गोलाकार किंवा वाटोळ्या आकाराच्या असतात, परंतु सिकल सेल या आजारामध्ये
so what happen in
आकार
sickle
विड्याच्या
cell
आकाराचा
is
किंवा चंद्रपुरीच्या आकाराचा होतो. तर थॅलेसिमिया या आजारामध्ये लाल रक्तपेशी आकार
so what happen in sickle cell disease is the normal RBC which are spherical in shape, they change their shape and they become the sickle cell due to excess of hemoglobin S in them. While in thalassemia, the size of RBC is smaller and they are microcytic. So small size microcytic RBC are seen in the thalassemia. In both of this disease, if the child has a major disease, thalassemia major or sickle cell major disease, then patient this RBC's lifespan may be decreased and patient may have different problem like in thalassemia they may require regular blood transfusion, while sickle cell patient have different problem like they may have vaso-occlusive crisis and may damage to their bones, or there may be the vaso-occlusion of brain vessels causing stroke like futures. There are many myths associated with sickle cell and thalassemia, and as we know, for overcoming from any disease, we have to require to clear these myths about this disease from the community's minds, because this myths prevents the proper way in the community to accept this disease and go for the screening program. So what are the different myths associated with sickle cell and or thalassemia? They are, it is usually thought that sickle cell and thalassemia are usually associated with only specific community and other communities are may not got this patient with sickle cell and thalassemia. Some people thought ki the person if got sickle cell or thalassemia may not survive beyond 18 years of age. Some think it is due to curse of the god. Some thinks that if the person is healthy, then he may not have any form of sickle cell or thalassemia. And some may think if we give the transfusion to the patient, then he may require regular blood transfusion. Or some thought in other way, if the patient has a sickle cell disease, he is going to require regular blood transfusion throughout his life. So this may be the different type in sickle cell and thalassemia. So thalassemias or sickle cell may have two type. One is the trait person or second is the disease person. And you can see, as you can see in this pictorial diagram, that normal person and trait person cannot be visually recognized. So by looking at the person, you cannot know whether this person is whether he is normal or whether he is trait. It can be only diagnosed if you test with Hb electrophoresis or some other specific test to diagnose the trait. While disease person can be easily recognized due to different symptoms in thalassemia. Sometimes in sickle cell disease, due to variable presentation in sickle cell disease, the disease person may be normal till some age and it may be difficult to diagnose him depending on looking at his or these are the different actors, sport person, which themselves have a thalassemia trait. So we all know Amitabh Bachchan, but yeah, okay. Slide is not moving. Why? Okay. Now you are able to see. Yeah. Yeah, last time also I have made it presentation mode, but I don't know why the slide are not moving. Yeah, yeah, no problem. If any problem arise, you can tell me at that time only. So we know that this we all recognize these great persons, and we know they are also thalassemia trait. So looking at the person from externally, we cannot say whether this person is normal or suffering from thalassemia minor. So recurrent blood transfusion may be seen in the thalassemia disease patient, but thalassemia trait patient doesn't have this. They not required any blood transfusion. In sickle cell disease, there may be pain in different body part in disease patient, but trait patient usually normal. There may be increase in liver and or spleen size in disease patient, and their hemoglobin is not going to increase by despite giving tons of iron. So in disease patient, all the symptoms may be present, while in trait person, they are absolutely normal.
या आजाराच्या केल्या पाहिजेत.
What happening? I don't know. If I should stop sharing and again reshare this thing. Yeah. नहीं full screen किया था, but I don't know what happening. The problem is there कि only one slide you able to see, and then
Just share your entire screen, one option will come. You can try
yeah,
with that. That will help, I think so.
I will do that.
Yes, sir. You can go to the presentation and
Now,
yes, sir. You can go for the slideshow mode. Yes,
yeah.
या आजाराच्या
yes, sir. Perfectly fine.
Now all slide you are able to see.
Yes, yes. It's moving
And
also.
okay,
Fine, fine. Perfectly
yeah.
fine.
Thank you. So who should check
या
for?
आजाराच्या चाचणी
हा.
कोणी केल्या पाहिजेत? सर्व व्यक्तींनी.
So who should screen for this disease? So ideally everyone in the community should
या आजाराच्या चाचणी
screen for this disease, because as we seen, it is a very common disorder. So everyone in the community should screen for diseases. But if anyone has symptoms suggestive of this disease, then they should always do the testing for this disease. Or if there is any family history of sickle cell and or thalassemia in the family, then they should test for the disease. Or sometimes if there is any family history of sudden death or requirement of blood transfusion in family member, then also we can screen ourselves or our family member for this disorder. So how this disease going to transmit from one generation to other generation? So this is the pictorial diagram in which you can see कि trait person is denoted by the pink color, normal person denoted by the white, while the disease is denoted by the red color. So we can see कि when out of father and mother, out of one is normal, completely normal, then there is no disease person in their children. So to have a disease in the children, it is necessary that both of parents should have either trait, or one person should be trait or other disease. So if only both are trait or disease, then this disease can be
या आजारासाठी
transmitted to the next generation. So which test we require to do to diagnose this disease? It is the Hb electrophoresis by HPLC method, that is the high performance liquid chromatography method. Because sometimes there may be different screening tests which can be used for the thalassemia and or sickle cell disease, like sickling test or Nestrop test for the thalassemia and sickling test for the sickle cell disease. But we may miss some patient with thalassemia and or sickle cell trait with this test. So it is advisable, if you are looking for the one person or we looking for our family members, then we should go for the HPLC method. This screening test can be used when we want to screen a large group of person. like entire community, if you want to screen, then we can go for first go for the screening test, and then we may go for the confirmatory test by the HB electrophoresis. But for the individual family or counseling of the individual family member, we should always do the HB electrophoresis or definitive test for the diagnosis. And how we can prevent it? By testing ourselves. So we have tested to prevent this disease in our children, and I request every one of you should check yourself for this disease to prevent this deadly disease in your next generation. This is the other link. You can take a photograph of this slide and you can go on this link so that you can know how much pain and suffering there may be in the patient with this disease life. So it is always advisable to prevent this disease. It is not only very cost effective. We have seen that this screening program are actually very cost effective rather than establishing and running the treatment program. So everyone in the community, if screened for this disease, we can come to the our aim that there should not be any child with sickle cell and thalassemia born by 2015 in Maharashtra, and maybe by 2000 uh, and maybe by century in all over India. So if you have now we if you had any queries and questions or comments, you can talk with me.
Hello, sir. Here, Indrani here, sir.
Yeah, yeah.
Yeah, sir. I just didn't get the concept that how do like using HPLC. I mean, how are you going to analyze hemoglobin chromatograph? I mean, what type of conclusion you can draw from that? And
HPLC is the diagnostic test for the sickle cell and thalassemia. So if we have a
okay,
sickle hemoglobin, so if you done HPLC after 1 years of age,
okay,
okay, I maybe by 6 month of after 6 month of age, because till 6 month there is a hemoglobin F maybe in uh, actually hemoglobin F, that is also known as a fetal hemoglobin, is raised, which can be raised in also thalassemia deceased person. So we may that value interpretation may be difficult up to 6 months. But after 6 months, if we do the HPLC and if you get the HPF very high, there may be only two possibility. A patient may be have either thalassemia major or patient may have the hereditary persistent of fetal hemoglobin. Okay. Similarly, if you have the hemoglobin S, which is more than 50%, then you know that this patient is the thalassemia sickle cell disease patient. And if the HbS is less than 50%, then you know that this patient is the sickle cell trait patient. So it is actually HB electrophoresis is a diagnostic test for the sickle cell and thalassemia. And it is very cost effective. And in most
yes,
of
sir.
the now, as it is on the government program also. So in most of the government hospital, it can be done at a free of cost.
Yes, sir.
So
I
what
had
you and
yeah.
initially you said it is a very costly test. So that is not very costly test.
Yes,
Yeah,
sir. So I just wanted to know, like, so from HPLC, like, based on the retention time, like one type of
right,
hemoglobin will have the
right.
one typical retention factor or retention time. So based on that, we can do that analysis, sir.
Yeah, yeah. Based on that, what is
Okay,
the
okay.
retention window, and at
Yeah, sir.
that window, what type of peak you are getting.
Yes,
According to
sir.
that, they can know whether it is a hemoglobin A, hemoglobin F, or hemoglobin S. There may
Yes,
be
sir. Yes,
different
sir.
types of hemoglobin, like hemoglobin D.
Yes, sir. Definitely. Yes, sir. Yes, sir. Yes, sir. Definitely. Because yes, sir. Hmm. HPLC. True, sir. True, sir. I understand that. Yeah. Yeah, that's why I just wanted to know because normally, usually in my labs, we run HPLC chromatogram for like testing drug concentration. I mean, as usual, like
Right,
testing in
right.
plasma, we isolate the plasma and then we check like how much drug concentration is present. So based on the same factor. So
Same principle, right?
yeah, yes, sir. That
So
was so
I want to
interesting.
correct here
Yes,
about one thing. Ki this is
yes,
not
sir.
a cost effective than CBC. So CBC can be used as a screening test to diagnose the thalassemia trait, in which you get MCV is low in all thalassemia patient. Okay.
Okay, sir.
Hemoglobin may be normal because patient is, if the patient is thalassemia trait, his hemoglobin usually going to be a normal, but his
Okay.
MCV is going to be low and RBC is going to be high. Okay.
Oh, okay,
So
sir.
if your
Okay, sir.
hemoglobin is 13 with your RBC value more than 5 lakhs and MCV is like 50 or 60, then you can
Yes.
suspect this patient may have a thalassemia trait along with RDW. RDW is a red cell distribution width. We show what different type of RBC you can have in the
Okay, sir.
blood
Okay.
smear.
Okay,
So
okay, sir.
with this test, right,
Yeah, yes, sir. So, I mean, that will be really so helpful. Yes, sir, it was so interesting. Thank you so much.
yeah,
Uh, Excuse me, sir.
yeah,
This is Pongode. I'm working on the sickle cell disease screening on the in the tribal population,
excellent,
and we are using we are planning to come with a program wherein we can have a non-invasive point of care diagnostics for sickle cell disease,
very good,
and wherein we use a sensor-based technology. And we have done initial, round of hospital-based screening actually, who are the confirmed cases. So this technology is basically for screening the population where the tribal population where there is a lot of the prevalence rates are high. So and
right,
in incidentally and in subsequently they can going for
definitive test,
this HPLC based or any other confirmatory test, which can wherein they can go for further treatment. So
right,
this screening module. We have developed and we are still in we are yet to commercialize. We are still in the process of doing the clinical validations and all is still awaited, and we are looking for funds wherein we can go for all these things. But the only issue is being a device for the societal cause, we are not having that much of the investors attention, and also the impact of the disease is not being understood by many of the people. So we would be happy if you can just guide us, because how do we go about going for the investors, because this we are also looking for thalassemia also subsequently, because we just want to introduce first one platform that is for screening the sickle cell disease in the tribal population,
right,
subsequently going with the thalassemia also. So if you can suggest something wherein we can
yeah,
get the attention of the people, the doctors, especially the clinicians who are taking care of, these sickle cell patients. So that is where we are just stuck in this process, because and a lot
yeah.
of things are
So
like attention is for the commercial impact of this, viability of this thing is always challenged because of this being a societal cause.
right.
Yeah.
So great initiative because
Thank you,
you
sir.
have been doing a very wonderful job.
Thank you, sir.
Doing a non-invasive test is a very great idea. But I
Mhm.
want to know the details, Miss. If you can mail me all this about this, how you are going to do that, and what is
Mhm.
the sensitivity and specificity of this test.
Mhm.
Because you may knowing कि there are many tests, like as we already discussed कि भाई
Yes, yeah, it's something
this
like a
test,
pulse oximeter we are working on. I can just share you all the details, sir.
yeah, yeah. So we can look at that data, and then I will give you the contact of National Society
Okay.
of sickle cell disease, and you can put forward to them your research or your whatever the your program is. So
Okay, sir.
they may help you. Okay.
Okay, sir. So how do I contact you?
I will share my email ID in chat. Yeah.
Okay, sir.
Yeah.
Thank you so much, sir.
Yeah.
Good evening, sir. So my question is, do we have any genetics heterogeneity in this condition?
Yes, there is a different genetic heterogeneity. Actually, itself, sickle cell disease itself is a very heterozygous and different manifestation in sickle cell disease. So we may have two brother and sister with sickle cell disease in same family, but both may have different manifestation. And sickle cell and thalassemia may be combined with, so there may be thalassemia, patient may have both beta thalassemia, patient may have beta thalassemia along with the Hb thalassemia, patient may have thalassemia with sickle cell disease. So you can get this varied combination of sickle cell or thalassemia combining with other type of thalassemia in our community. So yes, there is a very different genetic heterozygous.
Thank you, sir.
Okay.
Yes, sir.
What you want to know, whether different gene are causing the same disease or same
Yes,
disease?
what are the different set of genes? Like, what are the different set of genes which are involved in the causation of this particular disease?
Okay, so there is a Hbb genes which usually associated with the beta thalassemia and sickle cell disease, D thalassemia, Hb thalassemia. So all these are the different same gene, Hbb gene, that is the hemoglobin B beta gene, hemoglobin beta globulin gene, which is associated with this different type of disease, same gene. And sometimes there may be alpha thalassemia is a different form of gene where HbA gene is going to cause this different form of thalassemia. So that is a totally different form of thalassemia where clinical manifestation may be a different variety. Okay.
Yes, sir. Okay, sir.
Yeah.
Dr. Naresh, good evening. Am I audible?
Yeah. Yeah.
So I just wanted to know one thing from your side. As per your experience so far, in management of this sickle cell patient, where are we right now as far as this counseling is concerned? Like, do we have the expertise as you're expecting, or where are we right now? We wanted to go further in near future actually. As far as genetic counselors or counselors concerned in this particular management of the disease, just to bridge the gap between clinician and the patient as of now, where we are right now.
Yeah. There is a lot of need of counselor in every form of disease and specifically in this type of genetic disease.
Mm,
So usually in the peripheral level,
mm,
in the where we practice, usually clinician has to do this counseling type of job, and I think
mm,
it may be not the right person to do the genetic counseling job unless he
mm,
is specially trained in that aspects.
mm,
Because patient when comes to the clinician, they have
mm.
their different mindset. They want some treatment
True.
modality or drugs from the clinician. So if
True.
clinician try to give them advice about these preventive measures, they may not be
Mm.
that much receptive.
Right.
So if you have the proper person for counseling them about this genetic
Mm,
counseling and how they can go for the family cascade screening, like if one
mm,
person in the family is diagnosed with the sickle cell, then how
mm,
they should do testing in the other family member and
mm,
also see whether other family members are also trait or not. Similarly, how they should prevent this disease in the their next child. All this required proper genetic counselor, and we
mm.
are lacking in that. And I don't think, except in the metro cities, everywhere situation may be same. The genetic counselor, they may not be in that much numbers. But
So
during
as
corona pandemics, we think
mm,
teleconsultation may be helpful in this regards.
Yeah, I was about to ask this question.
Yeah.
How comfortable your patient is taking counseling session online rather than we used to do offline initially, even though we have a limited resource or expertise in this area. So where we, I mean, as far as acceptance is concerned, have you feel like they are okay with that? Even if you want to give genetic counseling services online, how comfortable your patient is? Like, is there any experience in recent
Uh,
past, mainly
I
after
I
COVID
not have
pandemic?
a direct experience, but
Okay.
I can say one thing: कि before Corona pandemic,
Mm-hmm.
patient may not that much receptive for the video consultation. But
Okay.
after Corona pandemic, most of the patients are also ready with the video consultation and they are accepting the advice given on the video consultation. Initially, in the
Mm-hmm.
small cities, patient
Mm-hmm.
usually always preferred to go to the doctor, talk personally, and then only take the advice or whatever
Mm-hmm.
doctor have suggest they take the treatment. But
Mm-hmm.
after Corona pandemic, they are become receptive for this teleconsultation.
Yeah, just one quick last question actually.
Yeah,
How, I mean, is there any recommendation how to educate, about all these services, the limited service that is already available, or, can we like how to reach to a common mass as far as awareness is concerned? Because most of the time, you rightly said, it started from that one, that there's a lot of myth
yeah,
and we still lot of scientific facts they are not aware of. So how do you like see in near future if you wanted to really raise the awareness in this segment of society, mainly underprivileged one, remote area where they are like challenged with information and technology that is not there at the
right.
doorstep. So how we are going to address those issues as, because that is what bothering me also, because I just wanted to know from your end as expert
Yeah,
in this area.
yeah, yeah. You are rightfully said कि this is the major issue, and
Mm,
I think कि awareing the awareness in the public is not a one day job. It is a
mm,
continuous process.
mm,
Changing the mindset of people going to take a long time,
mm,
but we have to work persistently,
mm.
continuously, and tirelessly for that. And if
Okay.
everyone in the community going to do this,
Mm,
we going to achieve this. And taking
mm,
this program, online program, is one of the method in that, though it is not 100% foolproof, because we have
mm,
to go to the people rather than online and
mm,
then talk with them. But educating the educated people and
mm,
then spreading this knowledge toward the general public is going to help.
mm. Yeah,
Okay, like in
yeah.
leprosy, we have seen ki initially people, there are many myths and misconception about leprosy, but as
Mm,
soon as the public aware that this leprosy is not associated with some god or some curse of the god, and they
mm,
know that this is due to bacteriological disease, and if we
mm,
can
mm,
test and take the treatment, we are going to cure from leprosy. We now
mm,
don't see the that much deformed patient with leprosy. Similarly,
mm,
once person like ourselves start screening,
mm,
okay, if we accept this thing and start from ourselves, we screen ourselves, our family members,
mm,
then other people, persons, pupils also going to follow us.
mm,
Okay, if you
mm,
advise them only कि भाई आप अपनी जांच करवा लो, आप अपनी जांच करवा लो,
mm,
and
mm,
they ask ourselves कि भाई whether you tested yourself, your family member or not, and then you say कि no, then they
mm.
are not going to listen us, right?
True, true.
Yeah,
Thank you, Dr. Naresh, for your taking out your time today. It's really wonderful experience for me, to have overview of this disease. Thank you
yeah.
so much.
Thank you,
Yeah,
thank you.
yeah.
Dr. Dhirendra had asked about the thalassemia patient. So hydroxyurea treatment for thalassemia patient, if patient is the beta thalassemia major, or now it is known as the transfusion dependent beta thalassemia, it is not useful and it is not sufficient. But if the patient has the thalassemia intermedia, or patient have if patient has the e thalassemia, this patient may help with the hydroxyurea treatment. Okay. So if that patient, if it is a younger patient and requiring transfusion in every 3 months, then there may be different reasons for that. The patient may be a thalassemia intermedia, or patient may have hypersplenism, which may causing his increase in the transfusion requirement. So recently, what happened? As happen with many disease, here so also sometimes we may able to overdiagnose the cases of thalassemia or sickle cell disease. There may be general misconception in public mind कि भाई सिकल सेल की टेस्टिंग पॉजिटिव आ गई तो वो अगर ट्रेट भी है उसमें निकला कि थैलेसीमिया ट्रेट है या सिकल सेल ट्रेट है एंड पेशेंट को अपन ने बोल दिया कि भाई उसकी डॉक्टर ने बोल दिया कि उसका सिकल सेल पॉजिटिव निकला और उसको ब्लड ट्रांसफ्यूजन लगना चालू हो गया. इफ द पेशेंट इज स्टार्टेड रिक्वायरिंग ब्लड ट्रांसफ्यूजन, पेशेंट में थिंक्स कि दिस सिकल सेल एंड थैलेसीमिया इज गोइंग टू कॉज दिस recurrent blood transfusion. So I always advise in this type of cases कि you should consult the proper pediatrician or hematologist to know whether what is the actual problem is, because just on history it may be very difficult to say whether the patient is the thalassemia intermedia. But one thing is sure, if the patient is transfusion dependent thalassemia major, then he is not or transfusion dependent thalassemia, then he is not going to help you completely cured with the hydroxyurea treatment. Right. Right. Yeah. No, there is a actually before transfusion only we give immunosuppression to the sickle cell and thalassemia patient. Otherwise, there is at present there is not actually any role of any immunosuppressant in the treatment of sickle cell and thalassemia, except in sickle cell disease we are using hydroxyurea, which is the anti-cancer drug, but it is a very safe for the sickle cell patient, and there is now more than 25 years of data for the hydroxyurea in sickle cell disease patient, and it is a really very safe drug for the sickle cell disease patient.
Sir, I had one more question, sir.
Yeah.
Sir, unlike, I mean, in cancer, mostly we see like, I mean, there is a constant evolution change that brings new genetic mutations. So, does this happen in thalassemia patients also?
In thalassemia patient, already there are more than all over world there are more than 400 mutation in the Hbb genes, but there are common 5 to 7 mutation all over India, which is 90% of the patient with thalassemia major. You are going to find out this common 5 to 7 mutation. Okay,
Okay,
but
sir.
otherwise
Okay,
there are
sir.
more than 400 to 700 mutation all over world, which may be seen in the thalassemia patient.
Okay, sir. I mean, is there any reports or still now, is there any studies that they've reported over time, say suppose sir, for a time period of 10 years or 5 years, there has been abrupt change in in those existing mutations? That
Still now there is not found out to be any other mutation which is uh,
responsible.
exceed this previous established mutation. Okay.
Okay, sir. Okay, sir. Okay. Thank you.
So yeah. uh, yeah, no, there are there are many community programs already running in different part of India, and I think there are many crores of rupees are uh, we have invested in this screening program, but actually we are not got very successful because what happened, this program usually run in another way. They go to the public, they ask, they ask or they just do the screening of whole public, they collect the data, go back. Public is also doesn't want to know what happened with this data, whether how many of us got positive, how many of us trait or not, and they carry on. Sometimes another company or another center may come in that community, do same things, and this process going on. This will only increase the cost of the testing and increase the cost of the program. But actually, we should start from the first step should be awareness, to start awareness in the community, give them importance of what you are doing, why it is very important. Then after testing, we should go back to them, do the counseling, ki these reports are come and these reports means these things, advise them to the cascade screening, so screen the other members in the family, testing them and found out how many members in the family also have the similar disease, counsel whole family, and then advise them about the how they can prevent this disease from occurring in the next generation. But this all these things are lacking in these programs. So now national hemoglobinopathy program is going to launch by the government of India, and I hope in this new program they will stress more on the awareness, about the awareness and community awareness program in this module.
Thank you, sir.
Thank you everyone. Just a kind request to everyone, ki please spread this awareness message to every friend of you in the wherever you live, the community members, and ask them to screen for this disease. Screening is the only way to prevent this disease in our next generation.
Can I say a few words?
Yes, sir. Definitely.
I greatly appreciate your presentation, and particularly the awareness is very important. And Jaipur has a very big center who deals with the thalassemia patients, and there is one Dr. Bansal. and he is attached to one hospital, Santokbad Vallabhji Hospital, and we keep getting such information, treating several of the thalassemia patients. So, in fact, I could have passed on this today's presentation information to him. But anyway, I will definitely advise that he should get in touch with Dr. Prasant and you as well, Dr. Naresh as well. Thank you so much.
Thank you, sir. Thank you very much.
Thank you, sir.